They asked me to talk about briefly, I promise I will not be as extensive as my previous colleague, Mr. Jonathan. I'm not a very good speaker like him, probably, so I'll make it as short as I can. As you know, Dubai and United Arab Emirates is an emerging market in so many different facets. You know that Abu Dhabi, the capital of the United Arab Emirates, we are 7 emirates. The capital state or the capital emirate is Abu Dhabi. And we have 6 other emirates. The main one of them is Dubai. And you all know Dubai being the center of tourism and commerce for the Middle East and connecting it to the world. The Prime Minister of the UAE and the ruler of Dubai, Sheikh Mohammed bin Rashid Al Maktoum, has always had the vision to develop the services provided to the public and private sector, to obtain international accreditation in healthcare, and to provide the services par, if not exceeding, the best in the world. We are a nascent nation. We have come into this world by uniting together in 1971, and ever since the United Arab Emirates has been working very hard on creating what it is today. So we're literally from the desert to one of the most advanced cities in the world in briefly no time from the time of the world, where it takes hundreds of years in other countries. We have made it come into this world in 42 years. Today, Dubai is known for its glamour. Everybody knows, or most of you might know, or might have heard, or might have hopefully experienced the glamour and luxury of Dubai. We have the best 7-star, best 5-star hotels in the world, the best services. We have the Dubai Shopping Festival, the Dubai Yoga Festival. We attract people to come and enjoy special experiences in Dubai. Dubai is very dynamic. If you look at the picture here, this oval thing on the street, this is going to be the museum of the future. It's something that you haven't heard anywhere in the world, and this is something that we are very proud of. It even looks very modern, looks very different, and we're trying here to by order of the Prime Minister, to create experiences for the future generations of UAE, to see how we were and what we did to make this city advance very quickly. So everything that we are doing, we do it in little prototypes, and it goes in that museum that is currently under build. Dubai is known to be the very connected city. Many of you, I hope, you have experienced the Dubai International Airport, which is now one of the top airports in the world. You know that Dubai is the 5th most visited city in the world. It has now exceeded New York in its number of visiting and revisiting. So we are there on the map of the world when it comes to tourism and creating special experiences. What we are trying to do now with the new strategy of medical tourism is, we know we have a base, wide arrays of hospitals, so we are known to be, in a way, a lifestyle destination. Restaurants, shopping centers, family entertainment, and we are ranked first in the Middle East and Africa in the Mercer survey on quality of life. We know that many people would like to even come and live in the UAE, and you know we have one of the highest percentages of expat living in the world. Dubai has got the foundations. As I said, we are a hallmark of diversity. We have 200 nationalities who live together in harmony. We are the only nation in the world that has just appointed a minister that looks after happiness and looks after diversity. So This is something that is there as a foundation in our government, in the vision of our government. And the Dubai 2021 plan that I'm currently involved in its division, it envisages a city of happy, creative, and empowered people on the best place to live, work, and visit. So a lot of the foundations of what we are doing is to ensure not just our people are happy, also the people who live in Dubai are happy, and those who come to visit Dubai, like yourselves, will also be happy and enjoy the services in Dubai. Dubai also is a time zone bridge. So Dubai International, as I said, ranked the #1 international passenger traffic in 2014, and Dubai is accessible to 2/3 of the world within 8 hours flight time, and 1/3 of the world within 4 hours flight time. And that is a fantastic location and time zone to be in. When we looked at all this, and we saw that back in 2012, we started looking at those interesting figures that were coming up for Dubai, and we saw that there are medical tourists that come into the city. At that time, roughly, the numbers were indicating around 107 medical tourists that walked into Dubai and left, and that I'm talking 2012. So we were in a meeting with the Crown Prince, His Highness Sheikh Hamdan, and he said, I have an initiative that I want to give to Dubai Health Authority. If already I have 107,000 medical tourists that came to Dubai and left, why don't we make it as another strategy for the government to make Dubai a welcoming place for those who want to seek medical tourism in Dubai? And ever since, we started working on this strategy that got approved in 2014. Just to shed some light on some statistics in Dubai, we have today around 33,627 healthcare professionals, and we have world-class health services with a total number of 2,772 healthcare facilities. I lead the medical tourism in Dubai, where I work under the health regulation department as a section in the health regulation, and our department looks after the licensing of professionals and facilities, as well as the monitoring of quality of healthcare facilities and professionals. And now we are working on 2 systems that will work parallel. One is the revalidation, again to be par with the advanced countries in the world like the UK, who are leading the revalidation of doctors. And also we are working on the total performance management program for healthcare facilities, which will really exceed what the international accreditation does. We're proud to say today that 80% of our healthcare facilities are accredited internationally, whether it's by the Joint Commission or by the Canadian International Accreditation or the Australian. So we don't limit our people to certain accreditation systems. As long as they are ISQA accredited, we are happy. But we think that we need one thing to take the accreditation further. It's not enough to do accreditation visits every 2 or 3 years. We need something that monitors the quality on longer term and makes sure that our people, as well as our visitors, the healthcare outcomes are all the time monitored and they are being improved. Another thing that works for Dubai in terms of medical tourism, and that is the culture sensitivity. When we talk about 200 nationalities, we're talking about 110 languages, 110 different nationalities only is in our healthcare system. So we definitely can speak your language. This is just a brief look on the proportion of the population that we have. So we're talking about the Asians. They represent around 30% of our population. 30% is for UAE nationals, and we have 10% who are expat Arabs. They come from the Levant countries or from other countries in North Africa. And we have the Americans and the Europeans, who almost make equal percentages of around 14% of the population. This is Dubai in brief. Maybe many of you have seen those wonderful pictures. You've seen, this is the helipad on the Burj Al Arab that many of you might have heard of, the 7-star hotel in Dubai. We have this beautiful, sometimes it changes into a golf course, now it's being a tennis stadium. So we're always trying to give our people something new and something interesting for them to come to Dubai for, and that is definitely with world-class service. You can see the Burj Khalifa with the beautiful surroundings there. This is the famous Burj Al Arab again, and this is the new Dubai Gate that we are building, and it will give another beautiful experience for people to go on top of it and have a look of Dubai. And this is underbuilt. We attracted in 2014, the numbers for 2015 are being finalized with our tourism department, but I thought I'll share with you some numbers where we had around 14.2 million overnight visitors in 2015, and that was an increase of around 7.5% from 2014. So the question is the economy vibrant? It's very vibrant in Dubai. And do we rely on tourism? Yes, a big part of our economy does rely on tourism, and it is definitely, the curve shows that it is on steady growth. We have welcomed in the first 9 months of 2015 around 10.5 million guests, and that is a good increase for the same period in 2014, where we had welcomed only 9.6 million, and I'm talking about tourists, not medical tourists. And today we are happy to say that we have had around 6,000 new hotels that came up in 2015, and there will be around 22,000 new hotel rooms that will come into Dubai by end of 2018. Our tourism department statistics also show that the occupancy rate at the Dubai hotels have always remained not below 77%. That's on average. So sometimes we have had months when the occupancy of our hotels goes into the 90%. As I'm speaking today, the hotel occupancy in Dubai is 92%. It's extremely difficult to get one room in one hotel, whether it's 2, 3, 4, or 5-star hotel, as we're talking. Our healthcare strategy. We have devised, maybe Jonathan knows, he was one of those we consulted with Renee back in 2014. Our healthcare strategy has got a 3-phase implementation. So we started by positioning Dubai, and we thought after positioning Dubai, we can move into strengthening that position, which were the activities we did in 2015. And by 2016, we will just go more broad. And as we're talking today, my team is back home working on launching the Dubai Medical Tourism electronic platform. We're launching our mobile app, and we have decided that we want to have our own identity, so our own logo for the project is going to go, and soon you will hear about the Dubai Medical Tourism having its own brand and its own identity, which will be launched in a couple of weeks by His Highness the Crown Prince. We have been very careful in choosing a patient-centric model rather than a commercial model, because it's very easy to commercialize healthcare, and that is what we are refraining from. We do not want Dubai to be known as a commercial health hub. We want it to be known as a patient-centric health hub, where people feel welcomed. They do feel there is a bit of difference in the service that's provided to them, and also the follow-up that happens to the patient when he or she leaves Dubai, that it continues. So the aftercare was very, very important. We held a brainstorming session where we invited so many of the other authorities in Dubai that have to do with this, whether it's the economy department, whether it's the Commerce Bureau, the Dubai International Airport, Tourism Board, you name it. We invited all of these, and we told them we want to have an innovation into what we are discussing. So we had around 80 innovation ideas that came out in this brainstorming session, and we have prioritized them, and we will implement them based on priority. And the plan will follow over the next 6 years, where we are changing Dubai from just being a medical tourism hub to become the health hub of the region. And our first target market is owning our backyard, so we are targeting our fellow brethren in the GCC and the Arab countries, as well as the Asian countries. The 6 goals that we have achieved were to ensure a healthy and safe environment for Dubai's people, ensure the provision of high quality, comprehensive and integrated health service system, achieving innovation in healthcare, improving efficiency in providing healthcare, and creating an integrated database to be used for the smart government policy in taking decision, creating an effective ecological system for the healthcare sector in Dubai in collaboration with the private and public sectors. We are probably the only city or only government that I know who advocates so strongly for its private sector. We take pride to say that the private sector in Dubai is definitely of high quality, because we are the ones who regulate it, we are the ones who monitor its quality, and we are proud to say to all of you that you can come and experience healthcare with our private entities as much as we are welcoming you to experience it with our governmental hospitals and governmental entities. What can be more than having global talent funneled into Dubai to say to the world, come and experience Dubai? What would be more than having the diverse cultures and religious backgrounds and the connectivity and the way that we are thinking of creating the happy experience? We thought maybe we need to make that more clear for our patients and for the facilitators and for the buyers. So we created some things that we thought they can put the mind at rest of those who would like to come and experience healthcare. One of them is we have devised the Charter for Patient Rights and Responsibilities. And this Charter for Patient Rights and Responsibilities is a very transparent charter where we tell the patient what he should expect from the healthcare facility and from the treatment, and at the same time we put the responsibility on the doctors and the services to give back to the patient equally. So this patient rights and responsibilities will be there on our website. The patient will sign on it, and he will know that he has, for example, right to second opinion, he has the right to have a translator if he doesn't understand the language, and we made that a mandatory thing through our policies. We thought one of the things that could put people's mind at rest is, I come to Dubai as a destination and I try to do a certain treatment. Then they do the treatment on me, I go back home, and then what if something happens to me as a complication of this treatment? And it's a very legitimate question. This is something that I asked myself, and maybe what compelled me to move forward with it. And I said, let me find if I can do for the people a medical tourism insurance. And we started working with a very renowned insurance company who have devised for us a very unique product, which was done by Lloyd's in London. And it is going to be, actually, as I'm speaking, it's being rolled out in Dubai. The policy is written, so we have it ready. And what it does is, the patient, when he buys or she buys a tourism package, a medical tourism package, with that comes a very nominal fee, very small amount of money that they pay, which will cover their travel insurance, as well as any complication that might arise from the treatment they do in Dubai. Up to 90 days after they leave Dubai, they come back on the insurance expense to Dubai, their travel is covered, their accommodation is covered, and the treatment on them is covered to be redone in Dubai. And I think this is something that is unique, and it's something that is very highly recommended, and it was definitely very widely accepted by the general hospitals in Dubai. So we have also created, if anything goes wrong, and again, you're not happy, where do you go to? You know, you're a tourist, you come to Dubai and you think, I don't like this hospital, what they've done to me was terrible, and I've got a major complaint, so where do I go to? We're not going to leave you. On our website comes a clear complaint management system where our department looks after it. Anything that goes wrong, everything is, it's got your electronic forms, you fill them, you send them to us. We have a certain deadline that we have to come back to you, and we assure you that the case will always be monitored and you will get an outcome at the end of it. So all these things, we put it in, everybody keeps referring to the triple Ps or the PPP, the public-private partnership. We have done it into the patient protection plan. The triple Ps, again, now can be translated in a more innovative way for our medical tourists in Dubai. I can't see Jonathan. Is he around? No, he's not. So Jonathan and Renee at the Medical Tourism Association, they announced in 2014 an MTI index. And in that, Dubai ranked as number 17 out of 25, as per the Medical Tourism Association. I'll give you some figures. We have When we presented this to His Highness in 2014, we said we envisage that today we have to around 107, 108,000. By 2020, we will get you 500,000 medical tourists. And then he said, are you going to involve everyone in the medical tourism? We have 2,000 at the time. We had around 2,000, maybe 200 facilities. We said no. Even this we are going to be very particular about. So we started a survey. Again, as I said, our department does the inspections and we do the licensure, so we know everybody. So we did a survey on the healthcare facilities, and we really valued who is going to be part of this initiative as a start. And we have identified only 30 out of the 2,000, 30 that we think can provide top service in terms of having translators, in terms of having concierge services, who have got a website that is, you know, wonderful and very adaptable, who have adaptable systems to be able to take in an influx of healthcare coming from abroad. So it's not that the rest are not good. They all have a good quality, but these people are ready for the concept of medical tourism. And the rest are working, obviously, to carry it forward. And then we created a little forum for these people to come and talk about how they are going to improve their work, what markets are we going to get into, and we called it, at the time, the Medical Tourism Club, just to have a friendly outcome with our healthcare providers. And we started from there to create a proper system of statistics. I remember our consultant for medical tourism coming from Thailand, maybe some of you know him, Mr. Ruben Taral. He said, gosh, Dubai is spending so much energy on even its statistics. We are working so hard on having, you know, proper statistics. We go down in the field, we verify every number that comes to us. So when we're reporting, we're not reporting huge numbers that sometimes don't make sense. He said, nobody else does that. We thought, no, we want to start on proper grounds. So today when I say I have, today, not in 2020, we have, with our work and with the work we have with the private sector, we have achieved the 500,000 medical tourists in 2016. But we look at the definition that we took them from the MTA, the Medical Tourism Association, which is the domestic medical tourism as well as the international. So anybody who lives abroad, out of Dubai jurisdiction, is considered a domestic medical tourist. So putting that with the international, we had 500,000. So 45% of the 500,000 were international medical tourists. My team today are working on furthering this and creating the health experience for people who come. So we're working very hard with our hotels, with our tourism department to create the new experience for you. So we don't want it just to become, you come to Dubai just for a boring hotel and leave. Things are going to take a new meaning in Dubai very soon. My aim with my team is to become the regional and international hub for medical tourism by increasing our online presence. We are going to have a dedicated website, as I said, and we want to engage with the end user to participate in a conversation about the medical services in Dubai and to talk about their positive experiences. Very soon, you will find all this coming into realization. So we want to connect. We want to spotlight, amplify, drive, and generate by positive word of mouth and by using past and current visitors as our brand ambassadors. Just to talk about the value proposition. They keep talking about value proposition for destinations. And I'm proud to say that my value proposition are the 3 T's, I call them. It's the talent of our healthcare professionals, combined with the transparency of our regulations and policies. They will definitely result into the trust in the system, the trust of the patients, the trust of the facilitators and the buyers in the market of Dubai. And that is our motto that we are trying to live by. Me and my team, we're working very hard on making this every day in front of our eyes. We have to be as transparent as we can, and we drive the private to be transparent with everybody. The patient protection plan, I spoke about it, and I did speak about the complaint management process. Just to brief you, things don't go just like that. It's not like one person does it. There are committees who do it, investigation committees that do multidisciplinary, who do the proper investigation. They give it to the review committee, and we notify the complainant and the concerned facility. So the facility gets from a simple warning, it can go up to revocation of license of the doctor, because we have the power to do that over the doctors. And thank you. Any questions? Yes. Sorry?
And I do a lot of business with Arab countries, particularly Tunisia before the Arab Spring. As a European woman, and a blonde European woman, it makes a big difference in Arab countries. I can go to Tunisia and drive a car. I can't do that in Dubai.
You can't?
No, I can't, can I? Women are not allowed to drive cars in Dubai.
Who said that?
It's reported in the newspapers.
No, it's not.
Right, okay,
No.
all right, I stand corrected. I do like to have a glass of wine frequently.
Yeah?
I have a lot of very strong-minded European women that come through me for medical tourism, and I think they would need some reassurance from the Emirates that if they came over there, they're not going to be arrested for not wearing the right things, for wanting to drive cars, for wanting to drink wine. You can see where I'm coming from, can't you?
I think that you have I'm not sure where you read that, but it's very funny what you're saying, because Dubai is known as the most modern. If you're talking about Tunisia ranks, I mean, we are way ahead of all the Arab world when it comes to freedom, when it comes to tourism, when it comes to women being the lead of everywhere. I'm in front of you. Do I look like coming from the ancient world? I mean, alcohol in the Islamic religion is not allowed for Muslims, but everywhere you can come and buy your drinks. And actually, Dubai is known for the very good wines, and some people are smiling in the room because maybe they have experienced Dubai. So I think what you have read about Dubai is totally untrue. We drive actually the best cars in Dubai.
I know you have the
And
cars.
it's a very safe country. I've lived in the UK for more than 15 years of my life, and I was never able to come out of my flat in London after 10 o'clock, while in Dubai you can drive your car at 4 in the morning and you're very confident that nothing's going to happen because it's extremely safe. So just to put your words aside, none of what you've read is true, and you can read more new reports, please.
All right. I hear what
maybe
you
you're
say.
referring to Saudi Arabia or other countries in the region, but not Dubai.
I hear what you say, and thank you very much for that. But we can only go by what we see on the BBC.
Yes,
and read
exactly.
In the
So
Daily
make sure
Telegraph.
you read the right thing, because it's not correct.
All right, thank you.
And I wonder where you read it. It will be very interesting to show us later. Thank you. Okay, anything else?
Zahid Hamid from the United Kingdom. Thank you very much, Linda. That was a very refreshing news from the Emirates, as with many other things that you've spearheaded in that island of prosperity in a sea of turmoil. So thank you for that. I've just got a couple of questions. Firstly, where do you see your market as lying? And secondly, medical travel or healthcare travel is a cost-sensitive area, as with anything else. With the spiraling costs in Dubai and in the Emirates, how do you see yourself retaining the competitiveness in medical travel?
Thank you very much. Very, very valid questions. First of all, yes, our healthcare in Dubai is not the cheapest. It's definitely one of the expensive markets. This is the question number one. I agree with you, but the clientele that come to Dubai and the services that we have encouraged our private sector to promote to start off are more of elective procedures where people would like to add it to their experience of tourism. As I said, we're riding the tide of tourism rather than the other way around. So we were known as positioned as one of the top destinations in the world, unlike what Linda knows. We are known like that. So we thought we can add with it one more thing added for the patient when he comes to Dubai, if they like to do an elective procedure. And we started off with promoting aesthetics. So we have one of the highest per capita number of aesthetic doctors to patients in Dubai. And we are promoting dental, because dental, we thought in other countries, they've got long waiting lists and we have very good doctors. And again, it's for quick procedures. And sorry, by aesthetic, I mean surgical and medical. So simple things like Botox, fillers, things like that, as well as the more complicated surgical procedures. And then we have the orthopedic surgeries, which are already known. We have a center of excellence in Dubai. It's called Burjir Hospital. And Dr. Tarabishi, he is one of the best in the world, known for especially knee replacements. So people already come to Dubai for that, and they pay for the quality. So we're not positioning ourselves for price. You know, in the map of medical tourism, in the ecosystem of medical tourism, there are various schools. So some people, they promote themselves being a center of excellence. So regardless of the price, you know that, for example, you go to Germany or Singapore, where they're expensive, but you still pay for them because they are known for being a center of excellence for that. Or others go because of proximity of geocentricity, or because of price. We thought in Dubai we cannot compete when it's based on price. We are more based on quality linked to tourism experience. And this is what was a bit differentiating, and that's where we're not competing with others. We have found our niche in that big ecosystem where we are targeting our own people, this clientele, to come to Dubai. Gradually, as we move from being just a little narrow-focused medical tourism into become the health hub, and as we improve the various arrays of the healthcare services, then maybe other competition might come into play and the prices will be controlled more. And now we're moving also with the insurance system in Dubai into the DRGs, so prices will also be controlled. So things are changing on that aspect, but I'm not maybe shedding so much light on it. But things are clear for us. Our target market, as I said, is the GCC as number one. We have the Asian market, India and Pakistan. And again, we don't look at people we are targeting are more who are looking at quality of health services rather than price bracket. And then we have patients who come from the UK. We have a hospital in Dubai that does around 30 bariatric surgeries per month only on UK patients. And this is just a number on top of my head. And they come to Dubai because they know, for example, this hospital is very good in that. They have no waiting time and the recovery is very good. So we have patients who come from the UK to our government hospitals. You'll be surprised at that, to do deliveries. They have elective C-sections that they come to do because they know that they have great quality and the recovery and the weather later, and they have a nice hotel to stay in, and they just have so much fun. So yeah, we do get patients even from the UK and from the American continent as well. So Dubai is open for everyone. We acknowledge that we're not the cheapest healthcare, but we're not seeking being cheap. And as I said from the beginning, we're not seeking commercializing our healthcare, because we can put price brackets and do this and compare. We don't want to do that. We're patient-centric, we're focusing more broad, and we will keep on walking on that path.
Thank you very much. Thank you.
Are we done?
Hi, my name is Latka. I'm coming from Spa Clinic Consultancy Company. I have a question for you regarding, do you have any initiatives to connect medical centers with spas or wellness centers as one of the options of the recovery programs?
Yes. Yes, we have in Dubai around 3 to 4 very special and unique resorts. One of them is Al Maha Resort, one is Bab al Shams Resort, so they're very well known and they're really high-end resorts that have got beautiful spas. And we are encouraging, especially those who will do orthopedic surgeries and they're doing aesthetic treatments, to connect the facilities with these resorts so as to have a better patient experience. And we have also 3 hospitals, 3 hotels that will come in Dubai in the next 3 years, who've got a segment of it dedicated also for medical tourists who can go there for recovery, and they can have like spa services, etc.
You mentioned Armada?
No.
Okay.
Al Maha.
Al Maha, okay, okay. Thank you.
Yeah.
Hi Linda, thank you very much for an excellent presentation. Very honest, and I'm very appreciative of the work you're doing in Dubai. I'm Daniel Shaw. My question is, you mentioned that you did obviously the internal comparison and assessment of healthcare facilities in Dubai. Are there any public available data that shows this comparison where patients can see and compare and see which clinic would be or healthcare facility would be best for them?
Okay, thank you. That's a very good question. And I maybe mentioned very briefly that based on that, we decided that we want to do the performance management. And once we have that, we're working on that actually with the CQC in London, where we are adopting and adapting their system. We're working with Sir Prof. Mike, who's one of the best in the world, who leads the CQC in England. And we are working with them to develop this performance management. Once we have it, you'll be able to click on the website of Dubai Health Authority, look at the various performance indicators and see which hospital ranks at where. So hospital ranking and rating is coming in the next year. And it was because our work was more of making sure that this place is good for medical tourism, and it was just to launch the the process. But when we did it, we discovered that there's much more to it that needs to be more transparent with the end user. And that's where we decided we are going to invest heavily into a proper system. And now we're just in the process of developing the indicators, piloting them. Already I've piloted part of it, but we discovered that we need to even increase the number of indicators, and that's what we're working with the CQC on.
Great.
And
It's
it
great
will
to
be-
hear that you're working with CQC. They're really
Sorry?
top of their league. CQC, it's great to hear that you've cooperated with them.
We
It's
are
really
working with them.
amazing stuff they're doing in the UK. Yeah, thank you.
Welcome.